Alrighty, so I guess we're just going to get started here. Welcome if you're joining us live, and hello if you're watching this just a little bit later and listening to the recording. We are presenting today on Ease Your Way into Getting Pregnant Naturally. Okay, so welcome. I am Dr. Sarah DiMunno. I am the naturopathic doctor, and I work here at the Institute for Hormonal Health. We do a lot in terms of hormonal health here, so anywhere from pregnancy to menopause. And we also have other practitioners that deal with acupuncture and skin health and cancer. So really great team at IHH. But of course, my focus is pregnancy. So today we're going to go over preconception and what that looks like, making babies, things to do to help that, and how to make that healthier, and when to seek help. When do you need, when should you worry? Awesome. So that is me. If you haven't had the pleasure to meet me in person, I call myself Dr. Sarah. I am a naturopathic doctor, like I said, and a self-proclaimed woman in power. So I've really made it my mission to help women with their health in order for them to live the life that they want to live. So a lot of that time, what that ends up looking like is me treating irregular cycles, cramps that keep you from living your daily life, any pre-diagnosed conditions, and of course, last but not least, fertility and preconception. But like I said, I do just love helping women improve their overall health, and we'll look a little bit into why there is a connection between your period health and your overall health a little later. Just in terms of my training, I did do a 4-year program at the Canadian College of Naturopathic Medicine, and in that time frame, I was lucky enough to get extra training in fertility and reproductive health. So I do have, and I've taken a lot of courses in terms of learning. I'm learning new things all the time, and I love kind of bringing back those things and educating you and my patients about that. So preconception, this is the time frame where we are looking to improve mom's health, dad's health, in order to make you in the optimal state for having a baby. When we do that, we improve the health outcomes of the baby, improve the health outcomes of the mom. So you're really, really setting yourself up for success. That time frame usually happens within a 3-month minimum, and that's because 3 months is the average time it takes for an egg and sperm to fully develop. So what that really means is whatever you're doing right now will affect the health of your egg 3 months from now, or the health of your sperm 3 months from now. So that's why it's good to give a bit of a time frame before you know that you're going to start trying. So why is this so important? You know, most people, they just decide they want to have a kid and go for it. Well, I was listening to Aviva Ram, if anyone of you likes to listen to podcasts, and what she said on this podcast was really shocking to me. It's the first generation of children that don't have a higher life expectancy than their parents. That is shocking. So shocking. When we think about how many resources that we have, how much scientific resources that we have, and the fact that our children now are having a shorter life expectancy than us is actually bonkers. And the fact that there is so much that we can be doing in terms of improving that, and things like what we're eating and the toxins that we're being exposed to, those all can kind of change that and change the overall health. So that brings us to making a baby. We'll talk a bit more about, more strategies later, but this is really important in terms of let's get you pregnant easier. Like, let's make those, what should you be doing and when should you be trying in order to get pregnant so you're not wasting any of your precious time. So the miracle of birth. I know it's kind of cliche to say and the miracle of birth, but it actually is quite the miracle. Honestly, if you look at all of the little steps and takes for someone to get pregnant and carry a pregnancy, it's actually crazy that anyone could get pregnant at all. And we'll talk a bit more about those steps as well. But yeah, it's honestly just amazing, and anyone who goes and is lucky enough to get through that process should be really proud of themselves for even making it through. So, of course, we're really not able to get around the fertility aspect of things without talking about the period. I want to kind of preface this that a lot of this presentation has to do with the female. We do talk about the male a little bit, but because they do go through the menstrual cycle, they're the ones to carry, they tend to get a lot of the attention when it comes to fertility. But that's not to say that the man is not important in this as well. It's 50-50, so don't forget about that aspect when you are trying to conceive. I just have so many female patients that are literally bending over backwards to make changes, and their male partner is still smoking, and that's just something that you want to address. So back to the period. That was a small digression. So this is a very simplified version of the period. There's kind of the two phases of the cycle. Day 1 to day 14, that's the follicular phase. Follicular meaning that is when your follicles are maturing or the egg is maturing. At that time, your uterine lining is also building up in order for your egg to implant. Then around day 14, you have your ovulation. And then the second half of the phase is more progesterone dominant. And that is either when you are potentially pregnant or you're getting ready for another menstrual cycle. And around the end of the menstrual cycle, that's when all your hormones kind of drop off, and that's when you get a period. The period is the inside of your uterus sloughing off. So I have a little arrow pointing to the inner layer of the uterine lining, which will be important later on in the talk. I also threw in here the moon phases. So just as an interesting tidbit, it is thought that the woman's cycle does mimic the moon cycles. So when we talk about the full moon, and I just want to point that one out, it's supposed to happen around ovulation. And it's thought because the full moon, the glisten of the moon on your skin, it's thought to actually make you more attractive to your partner in order for them to want to procreate with you, for a lack of a better way of saying it. So talking about cycle length matters. And the reason why it matters is because we can kind of guess whether or not you're ovulating or ovulating regularly, which obviously needs to happen in order for you to have a baby. So a normal cycle would be anywhere between 21 and 35 days. On average, the number that gets thrown around there is 28 days. If your cycle is longer than 28 days, or it varies if it's longer than 35 days, you don't get a menstrual cycle. Maybe it fluctuates. Sometimes it's 45 days, sometimes it's regular. In any of those scenarios, you probably want to seek a little bit of help in terms of how to better track when you're ovulating, because chances are you're not ovulating frequently, and if that's happening, you don't really want to waste time in figuring that out. So period as a vital sign. So vital sign meaning sign of life, like breathing, your heart beating, things like that. It might seem a little aggressive to call it that, but it actually does give you such an indicator of what is going on with your body. So, as a interesting fact, the American College of Obstetricians and Gynecologists actually made a statement acknowledging the fact that the period should be known as a vital sign. So what it says is the identification of abnormal menstrual patterns, so like your period coming irregularly, maybe heavy, et cetera. Early identification of those patterns can improve other health concerns for adulthood. So recognizing those early on in life actually changes your overall health, which is really crazy because I know that, a lot of the menstrual symptoms have been really, really normalized and they've been kind of muted, but we actually should be looking at them and paying attention to them because it could be telling us something that we could do something about now and prevent worse from down the line. Unfortunately, a lot of the time you start to care about these things is in and around the time of fertility and when you're trying to conceive. But it doesn't mean it's not too late to work on these symptoms. So things like PMS symptoms, so like this lovely girl here, she has some headaches around her period or maybe mid-cycle. Maybe she has breakouts around her cycle. She's pretty stressed, mood swings, cramping. All of those things are signs that your hormones are not balanced. And when we talk about balanced hormones, another reason why that connects to your whole body is that estrogen has receptors everywhere. It's actually important to maintain your bone health, your brain health, your breast health, your cholesterol. Like it actually does things outside of giving you uterine lining to have a period. If you have other pre-diagnosed conditions like PCOS or endometriosis, that does already kind of signify to us that you likely do have an underlying hormonal imbalance. So those are things and reasons why you would maybe want to seek more help in terms of balancing those. Now, the signs of ovulation. So when that egg drops, I talk about this with my patients. So as you know, fertility is one of my focuses. And a lot of my patients, I ask them about, okay, so did you ovulate this month? Or do you have signs of ovulation? And they kind of give me this blank look like, what do you mean? Like I peed on the stick. What else? So you got to really know your body because LH strips are useful to an extent, but it's really helpful to look at these other signs. So, like we had mentioned earlier, ovulation typically happens around that day 14 mark. It can be day 12, it could be day 15. On average, it's day 14. So I want to give you a bit of a pro tip. So I know that most of you, or a lot of you, are now tracking your cycles with period apps, which is great. It's so great. People have way more period literacy with those apps. So I'm such a big fan. The only problem with those apps is that they are guessing when your fertile window is. So it gives you an idea to kind of start paying attention, but it's not based on your physiological body. So you don't necessarily want to rely on that. And what you really want to do is learn how to monitor your body for ovulation. So those are things like cervical mucus, what we'll talk about a little bit more in a second. Increased libido, you might actually notice that you kind of want to have sex with your partner a little bit more, and that's because your body's telling you to get it on to procreate. You might notice an increase in your temperature as well, and that might be a little bit more distinct if you're taking your temperature, which we'll also talk about in a second. and other signs around ovulation, but they're not necessarily necessary. They're not what you need to happen, but you may notice if you get a mid-cycle headache. Some people can actually pinpoint what side that they're ovulating from, because it usually switches sides, switches ovaries, because you only drop one egg. You get like PMS symptoms and the bloating around that time frame. So now that you kind of have been pointed and to that, you might start noticing those things a little bit more. So this is your fertile window. This is really, really important. So find that one of the biggest mistakes when couples are trying to conceive is missing that fertile window, because there's this like notion that we're all fertile all the time. We spend so much time trying to stop ovulation that we don't when it's time to actually have a baby, we kind of don't really know when that fertile time actually is. So I have this, and I really don't want this for you. So this is why I'm gonna drive this home. So I have these couples that come in and maybe they're trying for a year, which would actually give them that infertility diagnosis and maybe give them a referral for IVF, which is the conventional medical system's way of dealing with fertility, which is fine if you need it, but you honestly really, really don't want to go there. It's expensive. It's really hard on your body. It's really, really stressful. So if you can avoid that, by all means, please do. So if that one couple had actually been trying within their real fertile window, then they likely would have gotten pregnant in that year, and they wouldn't have landed themselves into an expensive medical intervention. So, fertile window. Women are only fertile for 6 days of their menstrual cycle, and men are fertile every single day. So the reason why it's 6 days is because when you have sex, the sperm can last up to 5 days before ovulation. And once your egg is released from the fallopian tube, it starts to disintegrate pretty quickly. So it only lasts about 1 day after you ovulate. So that equals to that 6 days. The peak fertility is when to have intercourse in the 2-day window prior to ovulation. So what that really looks like is you having sex 3 days before you would expect to ovulate, and the sperm is just sitting there waiting for the egg, ready before it can have even a chance to break down. So that is what you want to try to do. So there are different ways to help you spot, because you're thinking, oh, Sarah, you're telling me not to rely on my app. How do I actually spot this fertile window? So there is what is called the fertility awareness method, and that is using your body's own signs and symptoms to spot your fertile window. Some people use this actually to avoid pregnancy without having any hormonal contraception, but you can also use this in order to become pregnant. So it tracks three signs. One is cervical fluid, another is waking body temperature, and the third is changes in your cervix. So if you don't know what your cervix is, that's what they swab when you get a PAP. And it's basically the little donut, that's what I call it. It looks like a donut to me, at the bottom of your uterus. So first and foremost, we'll go over cervical mucus. So this is another one that gets a little bit of confusion. So I ask my patients, like, did you get cervical mucus this month, or did you notice a change in your cervical mucus? And they're like, yeah, I have discharge. But until you ask them a couple more questions in knowing what it actually is, and what the consistency you're looking for. So what you're looking for is that egg white-like discharge. You don't want it to be like cottage cheese like. You don't want it to be opaque. You want to be able to see it. Or sorry, you don't want it to be actually the color of white. The thing that it can be confused for is maybe like a yeast infection or other vaginal infections, which you really want to take care of before you have a child as well. So definitely learning how to spot that. What can happen though is you can get what looks like that clear cervical mucus at different points in your cycle. If that's you, what likely is happening is your hormones are fluctuating, and specifically your estrogen, more than they want to. So then your body releases the cervical mucus. So that kind of shows that you probably have a bit of an imbalance there as well. Some people, on the other hand, might notice no cervical mucus, and I mean, if we're talking about optimal fertility, then that is an area that you likely can work on. Sometimes, honestly, it's easy as being dehydrated. So if you literally don't have the liquid to form the cervical mucus, you're not gonna make it. So definitely staying hydrated is a huge key aspect for this. Next aspect of the fertility awareness method is your waking body temperature. So this is when you wake up, so this is when you take your temperature daily and you record it. So it does require some commitment, I'll say. What you do if you are going to measure your temperature is take your waking body temperature at the same time every day. So you wake up, you literally don't try not to move, reach over to your nightstand, grab the thermometer, stick it in your mouth, measure your temperature, write that down. And around ovulation, it should increase by 0.3 degrees Celsius. So you want to make sure that at least has 1 decimal point in order to correctly identify the increase in temperature. And so it should increase for about 3 days, and that's usually your fertile window. If you do get pregnant, your temperature will actually continue to rise. If not, your temperature will go back down. And then the last aspect of the fertility awareness method is the cervix position. So like I said, it's that little donut shaped part of the uterus that sits at the bottom, so it's at the end of your vaginal canal. Normally that cervix will sit low, about if you insert 1 finger length into your vagina, and has a bit of a hard texture. So if you touch the tip of your nose, that cartilage feeling, that's normally what it will feel like throughout your cycle. Other than that, the days before ovulation, your cervix will become higher and softer. So that's another way to assess, and you can use those 3 aspects to really pinpoint when you are ovulating to make this easier for you to know that you're trying on the right days, because it can be very, very frustrating. Another aspect of measuring ovulation, so this is those strips that we were talking about and making fun of a little bit earlier, but they are actually pretty helpful. So this is where you just pee on the strip. And what it's measuring is the LH surge. So LH is a hormone that surges or rises right before ovulation in order to initiate the egg dropping. And you measure this in your urine. What you want to do is start around day 8, do one strip a day around day 8 until you catch your LH surge, and then make sure you're trying that day and the next day, because it means you're ovulating pretty soon. And as we talked about before, you want to make sure you are getting the sperm there before the egg drops. We have a pro tip here for you too. What is it? It is, okay, so make sure that you want to do this first thing in the morning on your first urination. Sometimes what happens is that I have patients that get really frustrated with the LH strips because they actually don't catch their LH surge, which can be like really, really distressing if you are feeling like, it's taking a while and what's happening with your fertility. So what I usually will recommend is try measuring your LH then twice in one day. So maybe in the morning and then like later on in the evening. That's because the LH surge actually doesn't happen for very long. So you could literally just be missing the window that it's happening. And overall, the LH strips do miss about 20% of LH peaks anyway, so you have to keep that in mind when you're using them. And last but not least, if you already know that you have PCOS, these people typically have elevated LH already. So when you do measure your LH with PCOS, it's going to look like a positive test strip for pretty much the entire month. So not really that useful for PCOS patients. Another honorable mention that's different and that's kind of being developed right now is called ferning. So, it measures your saliva and it looks at the peak in estrogen versus the LH because that is thought to give you a bigger heads up on when you are ovulating rather than giving you that 36 hours. The egg meets the sperm. So AKA fertilization. That's when the two become one and you make your embryo, which should turn into your little baby. So not too much to say about this aspect, but it's really just crazy that these two tiny, tiny microscopic things end up turning into human beings that walk around the earth. But what we really want to focus on here, because we're talking about optimizing your fertility, is what can we do to make those a really good egg and a really good sperm and to make a really healthy baby. So when we're talking about a good egg, things that we have to consider is age. Unfortunately, I can't reverse the fact of time. So as you age, typically your quality of eggs do go down. But there are things that we can do to reverse that, not reverse it, but prevent it or help it. What we look at sometimes, there's not actually a really good test. Like some people are very interested in looking at testing. And unfortunately, there isn't a great test right now in terms of looking at quality of egg. If you do an IVF cycle, they literally retrieve eggs from your ovaries and they can look at it in a petri dish and they do testing. So it does give a little bit of a better idea of your quality of egg, but still not that great. So what we can look at is, let's see what's happening with your estrogen and your FSH. If your FSH is too low, then your egg is going to be kind of slow. It's going to slow to develop, and that's not actually a good thing. If your FSH is too high, it's going to develop really quickly, and like lots of mistakes can happen there. So we're looking at those things. And then another just honorable mention, if you're really, really into the testing, is AMH. So AMH is thought to look at your ovarian reserve. So I know that if you are maybe approaching 35 or getting up there or a little bit higher in age, then you might be a bit more curious about where your ovarian reserve numbers are. If we really look at it, those only matter if you're going through assisted reproductive technology, and it actually doesn't matter as much when you are trying naturally. So that's kind of nice. If you've been given a number that hasn't been great, it doesn't mean that you can't get pregnant. It doesn't mean that you can't do it naturally. Just some honorable mentions here in terms of let's get these eggs cooking. I was going to say eggs healthy. So antioxidant status. So when I say antioxidants, there's these things called free radicals. There's not another nicer, fluffy name for it. What they do is they kind of bounce around your body and can't cause damage. And what the antioxidant does is it binds these free radicals and prevents them from causing any more damage. And when we think about antioxidant status, we really want that for any anti-aging. So if it makes you feel better, taking those supplements will likely help you overall in terms of preventing the fact of aging. We also want, for examples of antioxidants in terms of supplements, and we'll talk about diet after, our CoQ10 is a huge popular one in terms of fertility, and melatonin, and NAC. We really want adequate healthy fats. Healthy fats make hormones. So healthy fats are like avocado, coconut oil, olive oil, in terms of those building blocks for hormones. And then we want to also eliminate environmental toxins. So we'll talk more specifically about those things too, but just in terms of looking at a good egg, that's what you want to do. Same thing goes for sperm. If we're looking at age. Here we're looking at testosterone, the male hormone. In terms of testing, there is more for sperm testing than there is for eggs, so we can look at those parameters a bit easier. Same sort of lifestyle plan, so looking at antioxidants, looking at eliminating commercial or environmental toxins. 1 or 2 specific points for the men when we're looking at, well, I guess it's for men and women. So if you're using any commercial lubricants like the KY jelly, any of the over-counter stuff, even saliva and olive oil have actually been shown to kill sperm. So it doesn't even have a chance. You're not even giving them a chance to get to the egg. So you want to switch that out. Brand name Pre-Seed is thought to be a safe alternative to if you're requiring a lubricant in order to conceive. They claim it actually helps increase chances. I don't know about that. I just know that it doesn't kill the sperm on its way to the egg. Another special point here for the men in the room is the elevated scrotal temperatures. So there is a reason why the scrotum is outside of the body. It needs to stay a couple degrees cooler than the rest of the body. So that's when we were thinking about, are they wearing boxers or briefs? Are they sitting for long periods? Do they use saunas frequently? Are they keeping their laptops on their laps? Those are all things that you will bring down your sperm parameters. So back to the ladies, sorry men, about their happy uterus. So this is probably a little very, very new information. If you haven't heard anything new yet, this might be a bit more new for you. In terms of thinking about your uterine health, like I bet that's not something that's typically on your mind. Usually isn't until you know that there's an issue with it. But the uterus is where your egg, it actually burrows into the side of the uterine wall. So lots of things have to go right in order for that to happen. Like think about your immune system. Your immune system has to allow this foreign body to attach itself without going off and sloughing off. So that's really, really important. Usually this happens 6 to 12 days after ovulation has occurred, for thinking about timing, because the embryo has to travel from the fallopian tube down into the uterus and then attach. Sometimes because there's that burrowing, you can actually get bleeding, implantation bleeding. So sometimes people get a little distressed by that. I'm going to talk about it more in a second, but it actually could be normal that you get a little bit of bleeding just because there is that inflammatory reaction happening day of implantation. This is another key point, pro tip for you. Do not take any over-the-counter anti-inflammatories if you are trying to conceive. So around that, probably like as soon as you hit ovulation and after, you don't want to be taking anything like NSAIDs or Advil, because that will actually stop the inflammatory reaction in your body, and actually studies have shown that it stops implantation. So because it's stopping inflammation from happening, and you need it to happen in order for the egg to attach to the wall, the embryo to attach to the wall. So like I said, when your egg attach or sorry, when your embryo attaches to the wall, you can get some bleeding. And that can be completely normal. However, when you are trying month after month and you are waiting to get pregnant and you see some blood, it can be very, very distressing. Sometimes you don't know really what it means. Does it mean you're pregnant? Is it your period? Like it kind of happens around the same time. What if you had an off cycle? Like I know all of those spiraling thoughts that happen. So this is a really important distinction to have. Period and implantation bleeding. So let's go. Implantation bleeding. It's usually only lasts 1 day. It's gonna be a bit brown or pink. It's not going to be very heavy. It's going to be pretty light. Like it's going to be a bit of spotting on your underwear, and there's not going to be any clots. As opposed to your period, where it's going to last longer than the 3 days. It's usually going to have a lighter color to it. It can be light to heavy, but you'll be kind of aware of what your period looks like, and it might have clots in it if it's on the heavier side. So yeah, just keeping that in mind, the difference between the two. Then there is this thing called the implantation window. So we had the fertile window, and now we have the implantation window. So this is when that uterus, your uterine lining, is game. It is ready for implanting. And it's thought to last about 4 days. Usually happens around the 20th to even the 24th day of your cycle. And this can actually really, really change things. So if you have problems with the second phase of your cycle, it's either too short, you don't have any progesterone, this can change this aspect and change your fertility that way. So actually, to give it a little bit of numbers, implantation around day 20 to 24 of your cycle actually has an 85% chance. You reach day 25, it drops to 11. Goes from 85% to 11%. So it's quite the drop if you're missing that implantation window. Another thing to consider, and you also might not have considered this until you have a friend with it or it's happened to you and it's really, really unfortunate. If you have implantation failure, so you're having which could be considered a chemical pregnancy. Uterine receptivity is the case in 2/3 of the cases, and the embryo itself is a problem in the last 1/3. So your uterine health matters. It matters what your hormones are doing in that second phase. Because if you are having, the recurrent pregnancy loss, this could be an issue for you. Sorry, just taking a drink of water. Okay. Your uterine lining, so that inside of your uterus, you also would most likely not know what the uterine lining thickness is at this point. It's it might be a bit too much information, but it does matter as well. That is what is stimulated in the first phase of your cycle. If you have gone through the fertility process, you would know this number. But if you haven't, one way of you kind of deciding whether or guessing whether or not your uterine lining is thin or thick is looking at how heavy your periods are. So if you have very light periods or scanty periods, it's likely that your uterine lining isn't growing much. And so by the time you have your period and everything sloughs off, there's really not much for your period to slough off. I should correct myself in the 7 millimeters. That is usually around the time of implantation because your uterine lining does fluctuate. So if we're looking, like, okay, I want to start focusing on my uterine health, There are a few things that you can do. Drinking water, water just creates all of the liquids. It's the base of all the liquids in your body. So you needed to make blood, you needed to make cervical mucus. So let's get that water up and at them. You can be surprised at how drinking more water can change so many of your symptoms. It can make you go to the bathroom more. It can help you detox more. It can give you energy. Drink your water, people. There's certain foods that have shown to increase uterine blood flow, so you can have 2 servings of any of the foods listed there. I'm giving you an excuse to have some dark chocolate. Walnuts, watermelon, beets all have helped uterine blood flow. Movement. So for those of you who work an office job, you are likely sitting most of the day. So that's like 8 hours of the day. And think of where your uterus is. That is where all the blood is pooling. Nothing's moving. Literally everything is being shunted there. So what you can do is get up once an hour at least, just to move around, get things flowing again. That will likely help your energy levels as well. It's actually shown that even if you exercise, but you don't do that, you don't get up at least once an hour, you're not active throughout your day, it actually negates the exercise that you did. So make sure you're getting up at least once an hour. And general recommendation for exercise is 150 minutes of movement a week. So, if you're finding that a little daunting, just go for a walk, go to yoga, do something that is doable for you, and start off small and build, but that'll all help with getting that uterine flow. Another thing is topical castor oil. You can do that around your uterus, where your uterus would be. You only want to really do that on the first half of your cycle, especially if you're trying, but it helps literally bring blood flow to the area. And then deep breathing. So a lot of us breathe very superficially, and when you change that to abdominal breathing, first of all, you're going to most likely relax a lot more. You're probably going to have less muscle tension. But because of the proximity to the area, you're going to drive blood flow to that area. So as a quick little exercise here, I'm going to get you to breathe in. Make sure, actually, sorry. So don't breathe. Just kidding. Put your hands on your abdomen and really, really consciously feel where you are breathing into. And so then I'm going to get you to breathe in for 4. So breathe in, filling up your abdomen first. 2, 3, 4. Hold for 4. So 1, 2, 3, 4. Exhale for 4. 1, 2, 3, 4, and then hold for 4. 1, 2, 3, 4. You can do this for a few rounds. It's actually the most mini meditation that you can do. It stops all of your thought processes. So even if you're feeling a little anxious, you can do this. But because you are filling up your abdomen and breathing in and breathing out, that does bring blood flow to the area. All right. Oh, we are pretty into our presentation. Okay, so I'll try and speed things up a little bit here. We have a healthy body. Honestly, if I could have you drive home with any of the information that I want you to remember, is that a healthy body is a fertile body. Your body has to worry about getting you up in the morning. If your body has to worry about the food sensitivity that it's putting in there, if your body has to worry about, hustling from point A to point B to point C to point D for 12 hours of your day, it does not care about having a baby. It literally does not care. I kind of went through, so true or false after I said that, reproduction is the body's last priority. And I guess we can say Now that I gave that away, that is true. So this just leads me, I just want to talk about the fertile body and stress, the stress response. So literally when we talk about the stress response and when we're in, so it's the sympathetic fight or flight. So that's when you're kind of go, 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 your heart's pumping, your adrenaline's pumping. It's a really, really hard state for your body to be in. And literally, your reproductive hormones are turned off. If you kind of think of it like a light switch, if it's on and you're in your fight or flight, the other system cannot be on. So it's not, if you're in this system all day long, guess what? Your reproductive organs are not being tended to. So, which is an issue because, stress is so normalized. It's so normalized in this day and age. And I think part of all of this, not that it's necessarily causing infertility, but it's just so wrapped into our overall health. And I think we need to give ourselves more permission to go slow and go into that rest and digest. Rest and digest. Your digestion will be better. Your sleep will be better. You'll be more rejuvenated. You'll have more energy, and your reproductive organs will be turned on. It causes so when you have your stress hormone imbalances, so your stress hormone is cortisol. So we'll switch slides here. And that's what's released when you are under stress. And it's a really, it's called a catabolic, it's a catabolic hormone, meaning it breaks down things, it eats things. So anything that you're having, it's really just like burning through, and it's a foundational hormone. So if your cortisol is off, if there's an issue with your cortisol, your whole other sex hormone panel is gonna be off. There's no way, like, it's just going to undermine the entire thing because your body is thinking about how can I get more resources to produce cortisol to keep me alive, like, and keep me running from this bear. That's literally what it thinks it's doing. It's running away from a bear. It's keeping you alive. But, right now in our day and age, we don't have bears. We have bad bosses, we have bad relationships, but we don't have those bears. So we really need to calm our nervous system down. You can have too high of cortisol. You can have low cortisol, which is more of that burnout picture. But both of them are actually associated with infertility and early miscarriage, something that you really want to get a hold of. And surprise, you've lived your life, and up until this point, you're probably like, yeah, Sarah, I am really, really stressed. And guess what? Pregnancy is a stress on the body too. It's actually a huge stress on the body. And what do you think happens to when you tax a body that's already tired? And that's what happens to so many of my patients. And I really, really, really don't want that for you. You literally usually, like, this is what happens. You develop your coping strategies to get you to a certain point and you feel like you're surviving, and then you go through a pregnancy, and then you go through postpartum and breastfeeding and raising a 1-year-old, and then you get to the point where you're starting to kind of gain your life back a little bit, and then you're like, but crap, I can't actually cope. Like, all the coping strategies that I had before, they're just not working. And that's what I get. A lot of patients come into my office and they're like, man, I can't lose the weight. My energy is off. I have this foggy thinking, my hair is falling out. And I really think a huge part of this is the state of when you are pregnant. So let's get you healthy before you start trying to have a baby. Because after you have a baby, guess what? You're not going to have that time and that luxury as much as well. So here are, this is to me the foundations of health. There's diet, there's sleep, digestion, your stress levels, and exercise. And usually, if there's something off in this area, in general, I recommend working on it. So now we have gotten to the area where you can have take home things for you to do right now, starting to improve your fertility and your hormones. So first thing, just as a general recommendation, literally for anyone that's looking to get pregnant, is eliminate alcohol, eliminate marijuana, eliminate smoking, and decrease coffee intake to a small cup a day. So just to give you a reference, because some people will think, oh, I'm only having 1 cup, but I'm having a Starbucks tall or Starbucks grande. Starbucks grande coffee is like basically double the amount of coffee that you want, and even a tall goes over this amount of caffeine. So you got to be careful. And if you think coffee is not a big deal, I mean, it's up to you, but the risk of not conceiving in 1 year is 55%, so half higher than if you drink as little as 1 cup of coffee per day. And that's actually if it's caffeinated or non-caffeinated. So there's something specific about coffee as well, but it does greatly reduce your chances. Alcohol as well, as little as 1 glass of wine or beer a day can cut a woman's chance up to 50%. I'm so sorry. I'm so sorry. Coffee and wine, I'm sure you love them, but if you're looking to really make this an easier time, then cutting that out would likely be your best option. All of these things studies have been done to decrease fertility, decrease egg quality, and decrease sperm quality. So definitely want to do that. Next is being on a prenatal. So usually want to start that 3-month mark before, at least. Honestly, prenatal vitamins, they're probably the best multivitamin that you can get, just because they usually have the right dose of everything in the right forms. So I kind of think that if you want a multivitamin, take a prenatal, honestly. So you can be taking this forever. But if you're just taking it for your conception, to start 3 months, please, the brand matters. And I can't talk about brands because of the nature of this. But what I want you to look for is prenatal with that it's low on fillers, that has the right doses and the right forms. So there's different forms of the nutrients. For example, iron, you want iron bisglycinate for the least amount of side effects. And so you might have to do a bit more digging or asking. I actually have a comparison form, so if you do want to shoot me an email or a DM on Insta, let me know and I can send you that for sure. Other supplementation that you definitely want to consider is fish oil. So when you get pregnant, your fish oil, or sorry, your essential fatty acids, they go right down. So when people say they have baby brain and they can't remember things, like as soon as they get pregnant, that's what's happening. That's becoming deficient. So supplementing that, and it also has to do with the development of the fetus as well. So definitely fish oil, probiotic. Just as a specific thing for you is that probiotics have been shown to prevent postpartum depression. So that's something that's on your mind, but just in general are a good idea. Low vitamin D levels. So low vitamin D levels are associated with recurrent pregnancy loss. So if you are noticing that, you are one of those people, unfortunately, that have recurrent pregnancy loss, or you just want to avoid it, please test your vitamin D levels, because you could be shocked. A lot of people think they have normal vitamin D levels, but let me tell you, Canada does not provide you with enough vitamin D. So definitely get those tested and prevent the miscarriage. And then iron. So iron is just in high demand when you are conceiving. And if you do have anemia, which is like most menstruating females have low iron and anemia, or they just have low iron, then you definitely want to be supplementing that. Another aspect that you can start doing, if you're not already doing this, because I know because there's so many apps out there, you want to start tracking your cycle. You're not going to know when you're ovulating. You're not going to know if you have any hormonal imbalances if you're not paying attention to them. So start tracking your cycle. If you need an app, use an app like Flow. There's Period Tracker, Clue. I don't really care. Whatever you like to use, they all kind of are the same. In my opinion, just start using one and paying attention to your cycle. Exercise, we kind of touched on this with your uterine blood flow, but what I really wanted to mention on this slide is that if you are feeling like you are that person that is really, really stressed out and having cortisol issues, especially low cortisol issues, what might happen is that you exercise and you feel way worse. In that case, I'm going to say, and which is probably really counterintuitive, exercising, at least vigorous exercise, is probably not a good idea for you. It's going to make that burnout worse because what happens is your body calls on cortisol when you are exercising, and if there's no cortisol to call on, then it's just going to magnify the situation for you. So really be gentle and do things that where you're at. So great gentle options, like I said, a restored, not hot yoga, please. Hot yoga is great if you're strong enough for it. It's so cleansing, but if you're not there and you're more burnt out, a restorative yoga or just a normal class, temperature classroom, walking with a partner. You can do stretching at home, just moving, just making that effort to move. And this actually helps with not only the uterine lining, I want to relate it back to hormone detoxification, general mood, when we're talking about preconception and conception work. Oh, sorry, and also with period cramps. This, if you start exercising regularly and you have normal cortisol levels, it will actually help with your pain tolerance. So, stress management, as you have noticed, I find this, I'm very passionate about the stress management. So what I try and tell my patients, because this can be fertility can be really stressful, especially if you're having issues with fertility. I posted this Instagram story the other day, and in case you haven't seen it, I'll relay it again, but for infertility at least has been shown to be just as stressful, or sorry, second to stressful as cancer, getting a cancer diagnosis. So it's a really impactful. This means a lot to you, and I know it does. So let's implement coping strategies now so that we can deal with that. So what I tell my patients a lot is that let's practice presence. Because if you're thinking about the future, if you're thinking about the past, you're not in the present. And often those times tend to be a bit more anxiety provoking or depression invoking. So this is, this is what I say. I say I'm not going to try and make everything better because I know this is frustrating and you should recognize it's frustrating. But what you might want to do, what I'm going to try and do is make you more present. And they're always like, yeah, you need to be more present. I'm like, yeah, this is kind of like a revolution. We have so many things distracting us, but we want to be more present. So one thing, and this is what will help you click that switch. Remember that light switch I said? On is the fight or flight, off is the parasympathetic, or that rest and digest that you want to be in to regulate and heal your body. So things that you can do is practice meditation. This might not be the first go-to for everyone, but if you do it honestly daily, I think is the best way. Just getting in the habit of giving your brain that time to process and have some quiet space. Get outside. Nature is such an underutilized modality in terms of that it actually is shown if you're outside in nature for 20 minutes a day, that flips that switch down into the parasympathetic. So easy. Not taking any pharmaceuticals, not even taking any supplements, literally just going outside. It's free, people. I mean, I know it's been really crappy weather, but let's just, maybe if we all go outside and just look up, the sun will come out. But yes, getting outside and making that a priority, especially those people, you might be working in an office cubicle and you're not seeing the light of day. Like, make it a priority to step outside, even for 5 minutes during the day. It honestly will make you feel a lot better. Go slow. This is one that I think gets forgotten about a lot, is the hustle, man. That hustle. Everyone is hustling from point A to point B, and there's not that priority to go slow. And I think we need to kind of return back to that. So sometimes, if you find this a little hard, put it in, and you're a to-do list person, which I think a lot of us are, put it on your to-do list. Like, take a break for half an hour, or if it works better for you, to schedule in, from 9 p.m. on, I'm not on my laptop and I'm just doing things for me, and I'm doing self-care, or I am reading my book and just focusing on winding down. Or if that's in the morning for you and you get up early and you just kind of sit and make a tea, something that you schedule in once or twice a week at least, and make that a priority. It is productive. It's still productive for you to go slow, because in that time period, what you are prioritizing is healing. So if you're having a hard time wrapping around going slow, tell yourself, this is productive. I'm helping heal myself. This is what I need to do. Using your senses. Let's see if we have time. Yeah, we have time for this as well. So here, let's go through another exercise. So, and I won't go through the whole thing, but just enough to give you an idea. So what you can do to start is do that breathing exercise. So breathe in for 4, hold your breath for 4, breathe out for 4, and hold your breath for 4, and do that a few times just to kind of get you into the moment. And what you can do then, and I'll get you to do it now, just like in your head or at home, tell me or tell yourself 3 things that you see around you. So that could be, I'll do it myself here. There's a painting, there's these curtains, and there's a hook that I'm looking at. 3 things that I can hear. Well, my office is pretty quiet right now, but I can hear the chair swiveling, I can hear maybe someone text me, and I can hear my hair when I twirl it. And then 3 things that I feel my vest on me, I feel my shoes on, and I feel my pants on my legs. Get the idea. Then you move down to 2, you move down to 1. And what that does, if you realize, and if you're doing it along, it's really, really putting you in that moment. It's putting you back in that headspace. It's putting you back in that room, in that present moment. And so that is a really good technique, especially if you feel like you're someone that does overthink or isn't present a lot. It really puts you back into it. And I can tell you that even the people around you will really appreciate you being more present. And last but not least, but I'll talk about in a little bit, is something that I like to do is acupuncture. So what I use acupuncture for is your cycles, but also what happens is called the acu-nap. So it's that time it's that place between, like, you're not sleeping but you're not awake and you're just like zenned out. That's what acupuncture is amazing for. So it kind of is like a gateway to meditation. So you don't have to like work as hard to get to that zen place. So it's absolutely amazing. What I wanted to mention is, don't forget that stress management, stress also counts other than mental emotional stressors. So we can identify those really easily. A lot of the time what we forget about that actually stresses their body physically is over-exercising, under-eating, any active infections, any lack of sleep, eating foods that are really inflammatory, or eating foods that are your personal food sensitivities, working long hours. And just to put in there, if you've ever been pregnant before, you want to think about timing in between your pregnancies, because that's a huge stress, as we've already let you know. In terms of overall diet, this is also a big focus because you kind of know that how much food can change your diet, or sorry, change your overall health. So in terms of the antioxidant status that we talked about before, really like what we want you to do is just eat the rainbow, eat really colorful fruits and vegetables, change it up, make it really vibrant. Definitely looking at antioxidant status. So like blueberries are really, really high in antioxidants. And then just I put that in brackets, the organic for the dirty dozen. So that's just a list that the environmental working group comes out with. And they have the clean 15 and the dirty dozen. So if we're looking at decreasing environmental impact and toxins, we want to buy organic for at least the dirty dozen. Because those are the top 12 foods that have the most pesticides on them, which is kind of gross, if you ask me, and they can actually impact your hormones. What we really want to make sure that all of our meals have healthy fats, fiber, and protein. I think a lot of people are starting to get on board with the protein, but forgetting about the healthy fats and the fiber. And the fiber can come from those green leafy vegetables. Like, they have a ton of fiber in them. You don't need to get them from any of your carbs. And I think that's a bit of a misunderstanding or a misconception. So in terms of what is the best diet, because I feel like people are kind of like, tell me what the best one is. It's kind of inconclusive. What we do know is there's a diet called the Mediterranean diet, and it has shown to likely be the best diet that there is, especially if you are going through assisted reproductive technology or IVF. So, but it's also just an overall really great diet. Like, it brings down diabetes rates. It also treats cholesterol. So what is great about that diet, it does incorporate healthy fats. Mediterranean, they use a lot of olive oil. So that is something that kind of, if you are following that diet, you're likely eating a well-balanced diet. It does include dairy. Dairy is more of an individual base. So I left that out today. It really depends. Removing your food sensitivities. If you are aware of your food sensitivities, definitely avoid them. If you're not sure, there's definitely ways to identify that, but that would be better done or best done in a personal intake. And then, like I said, do not forget about your water. Drink your water. Just as a fun little take home here, this is something called the seed cycle. So you can use this to help optimize your hormone levels. And what it does do for you, without even having to think about it, is boost your levels of fiber, and it boosts your levels of healthy fat and whatever micronutrients that are found with these seeds. So it follows your cycle. So in the follicular phase, so from day 1 to 14, you do ground flaxseed and ground pumpkin seed. And then on day 14 or day 15, I guess, to your menstruation, or if you're trying to regulate day 28, you do ground sesame and ground sunflower seed. And the reason why they do this switch is because they found that depending on, ground flaxseed and pumpkin seed tend to be a bit more supportive or balancing for estrogen, and the latter for progesterone. So definitely worth a try. It's just a really, really easy way of helping gently push or gently nudge your hormone levels into the right frame. Because if you're noticing that you don't actually really have a lot of symptoms, this might just be enough to push you over to the edge. Just as another kind of FYI, and this is something that I wanted to bring up because I've heard, or Google, you could look on Google, a lot of people have that detox, like a fertility detox. So definitely don't want to be detoxing if you're actively trying to get pregnant, because the baby, the fetus, is just going to get a dump of all of those toxins that you are letting out. So definitely don't want to do that. But if you have time prior to and you're looking to, strengthen your body and make you the healthiest that you are, then definitely a good idea. So when we're doing that, we look at protocols that support the liver, making sure you have one bowel movement a day at least, sweating, and cleaning up your diet. This is just a screenshot of a handout that I like to give out to some of my patients, and it's talking about those endocrine disrupting chemicals. So fancy way of talking about those chemicals in our environment that bind to our hormone receptors and confuse the hell out of our bodies. So your hormone, you might not actually have high estrogen, but then your body is acting like it does because it's getting confused by these. So that's why you just want to eliminate that aspect, especially if you're thinking about getting pregnant or you're already pregnant. You really want to be doing this anyway. Like everyone really should be, but especially when you are trying to conceive and pregnant. So that looks like taking away plastic, or switching out plastic to stainless steel or glass, switching out chemical cleaning products, switching to natural beauty products. One thing that I find, and this was maybe more so a personal aha moment, is to-go coffee mugs or coffee cups. Like if you go to Starbucks or Tim Hortons or any of the other chains, all of those cups have an inner plastic coating to prevent it from disintegrating, and then you're putting hot liquid in there, so much plastic from that exposure from that. And then another one is Keurig. So Keurig coffee cups, like a lot of them have that plastic outer cup, and then you're heating it up and then pouring hot water through it. So definitely areas that if you're having every day, you might want to change and pay attention to. Okay, so we're kind of nearing the end of the presentation here, but definitely want to know, for those of you at home are like, okay, yeah, I'm ready to try, I've gotten this far. How long should it take? So statistically, 85% of couples will conceive after 1 year, 93% after 2 years, and after 3, without a prognosis or some sort of treatment, likely it's a poor prognosis. And then you can look here, depending on whatever your age gap or your age bracket is. I just gave the average number of months that it would take to conceive by age. So when you want to seek help, so technically infertility, when you get that diagnosis of infertility, it's 1 year of trying before the age of 35 and 6 months of trying after the age of 35. That's because so you get a little bit older, there's more of a time frame on that. And you want to be doing diagnostic testing prior or as soon as possible. So if you're going by conventional standards, this is what is given. So even if you went to your family doctor, to be honest, and you were like, hey, I want to start trying, they may be like, hey, are you on a prenatal? At least cover that basis. Some of them might not even do that, and then send you on your way and they'll say, come back in a year. Come back in a year if you're having trouble, if you're under 35. And so there's not, depending obviously on your family doctor, but that's probably on average what they'll say, because they're really busy with other things as well. So you might want to see another kind of practitioner if you're really looking to seek optimal pregnancy and health. So in my eyes, when you want to see or seek help, if you feel like you have areas of weakness around your diet, sleep, digestion, stress, exercise, like I said, if you are, and I really want to stress, if you are one of those individuals that have high stress or you're already feeling burnt out, please, please get treated, or at least try and make the changes to kind of start healing your adrenals, because we will tax the hell out of them once you get pregnant or if you get pregnant. So definitely, definitely, definitely want to get help with that. If you're already noticing that you have menstrual irregularities, there are a few female conditions that we know that do slow down fertility. So definitely want to make sure you're getting diagnostics for that. As a postpartum prevention, maybe you've already had a baby and you know that it was really difficult for you. What I really wanted to talk about here, actually I'll talk about it in a second, leaving your health legacy, making sure that your baby is healthier than you. Like I mentioned when I first started the presentation, like the first generation, remember, first generation that's not living as long as their parents. So definitely, if that's a priority for you, definitely seek help. And then if you already know you have a reproductive condition like PCOS, endometriosis, and fibroids. And just to point out, so anyone that comes in with those issues, you would get like an individualized look at what's going on for you specifically, and you would dive into all of those foundational aspects. And then high risk. So I just wanted to put this here just as an educational point, if you do already know that you have diabetes or are pre-diabetic, if you have hypertension, SLE, epilepsy, anemia, or thyroid, then you definitely already know that you are at a higher risk for a difficult pregnancy or a high-risk pregnancy. So you probably want to start working on that prior to getting pregnant, or at least like knowing that if you do get pregnant and you have one of these things, to seek help right away. Especially, so the anemia, try and get a hold of that prior to getting pregnant, and then your thyroid disease as well. So basically, I want to expand on that a little bit with your thyroid. If your TSH is high, then that is, but you don't have a thyroid condition. So you want your TSH basically to be under 2.5 to prevent miscarriage. So want to definitely look at that. If you already know you have a thyroid condition, then definitely look at that. Your thyroid tends to increase as when you get pregnant. So there might be changes, and you might need to be on thyroid medication, literally just for your pregnancy, all keeping an eye on that. So what I am doing here at IHH, which I'm really, really excited for, and this is kind of part of the launch, is the preconception program. So at IHH, I work with a medical doctor. So what is really great is that if I do need to do any of this testing, or if we want to do it kind of preventatively, or then I have the access to Dr. Prouse, Dr. Christy Prouse, and we can get you that testing under OHIP, which is great. Otherwise, what we look at is doing a series of acupuncture sessions specifically designed to where you are in your cycle. So how I said the menstrual cycle naturally fluctuates with where the hormones are at. So we'll definitely have a diagnosis, a specific diagnosis that we're following for you for acupuncture. Obviously, like I said, lots of stress management aspect to that. Sorry. And what I wanted to mention is if you do have PCOS or menstrual irregularities, or like diagnosed like endometriosis, conventionally everyone with PCOS has PCOS. With Asian medicine, we can further differentiate between those individuals using an Asian medicine diagnosis. So not everyone who walks in the door with PCOS is treated the same. So that is kind of unique in terms of acupuncture and Asian medicine. And as a naturopathic doctor, I am trained in that. We'll obviously talk about more specific dietary support to help you hormone build, or if we know you have a certain condition, what's the optimal diet for you, identifying any food sensitivities. Hormone testing, like I said, what we can do in terms of hormone testing is what's called the Dutch. So instead of just measuring a few of your hormones, it's really, really looking at those detox byproducts and making sure you're doing it in a safe way, and that your hormone and that we're capturing any sort of hormonal imbalance that could be there, which can be hard symptomatically sometimes, but if we kind of know and we have signals of that, this is a great test. I cannot rave any more about this test. It's so awesome. An option here at IHH, we do have an IV suite. So if you are identified as that burnout, that might be something that is recommended for you. It seems to be really, really helpful to kind of get you back on your feet. Or even if you're postpartum, that's a really great idea, is doing some IV therapy. And then any supplements and botanicals specifically chosen for you. So that's all what you would get during the preconception program. So just to kind of sum up here, a healthy body is a fertile body, and it equals fast recovery. So I think this is another aspect, like, yes, you want an easy pregnancy, but honestly, it's the aftermath that really you're thinking ahead for, because that, like I said, the weight loss aspect, the hair loss aspect, everything is just kind of haywire and your coping mechanisms are all over the place. You want to prevent that as much as you can now. So definitely that healthy body, fertile body, fast recovery, all of it is all connected to your overall health and your reproductive health. Okay, awesome. So this brings us to the end of the presentation. Thank you so much for joining me today. If you have any questions, or like I said, you wanted to actually see my chart for comparison for prenatal vitamins, definitely shoot me an email or a message at Dr. DiMunno ND. So Dr. DiMunnoND on Instagram and on Facebook, and I will definitely send you that or answer any of your questions if you haven't already. If you have any questions about the preconception program, if you have individual questions, like I definitely do discovery visits, so if you want to ask me more individually about how I can help you specifically, definitely let me know. Okay, so thank you so much again for joining, and I wish you, I'm losing my voice here, a happy Thursday and happy conceiving. Thank you so much.